Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and also the co-host on the show, It's About You on WKYC Channel 3, where weekly I lift up people that are doing great things in the community. We call them everyday champions. However, this series is about you. Yes, it's about your health and about gaining your strength, even during a pandemic. You know, as a community leader, I felt it was good to partner with a hospital such as University Hospitals to make sure that you're living a healthy life. So today I have a special guest who's here with us today, Dr. Nicole Maronian, who's here with us, and she's going to tell us about our topic for today. So what are we going to talk about, Dr. Nicole?
Hi, it's nice to be with you today. My name is Nicole Maronian. I am the chair of otolaryngology, which is a really long name that essentially means I'm the chair of ear, nose, and throat surgery at University Hospitals. And we are going to talk about healthy aging and a healthy voice.
Sounds good. I'm into learning all about this. I know we have a lot of seniors that love to watch our segment. So tell me this, does the voice change with age?
It actually does. Everything changes with age, unfortunately. And so the voice is very much like that. When we think about the voice, we think about the voice box. The voice box is that area in the throat where we feel our Adam's apple. And behind the Adam's apple are two structures, two muscles called the vocal cords. The vocal cords open when we breathe, they close when we speak. And those muscles are very similar to all the other muscles in our body. They change with time. So the most common things we see with aging of the vocal cords is that they get a little thinner, they get a little weaker, and the structures around them get a little bit stiffer, just like our other joints do. And the linings of our throat get a little bit drier. And all of those things in combination can affect the voice as the ease with which we use the voice.
Would you say that that's a cause for concern, or would you say it's just natural, or when do you know when it's time to see a doctor for something like that?
You know, I'm a voice specialist, so this is what I do. And so for me, the voice is really that window into the soul. Some people say it's the eyes. I think it's the voice. When you get on the phone with someone, when you're listening to someone, you can really tell. Are they having a good day or are they just kind of feeling lousy? So that voice that's clear and projecting well is very different from that voice that's kind of quiet and raspy and I'm tired, I don't feel good. So you know instantly about how someone's feeling. And so if you're noticing, I think with aging, a change in that voice, it can be really subtle. It can be slow. It can be mild. But I'd pay attention to it because that, again, that voice is a window into what's going on inside.
Wow.
So I think it's important to think about your voice. If the voice isn't letting you do the things that you're used to doing, I think it's time to have that looked at.
Wow. So how does that visit look like if you go to ENT, you say my voice has changed or something's a little different? What should I do? So how would that visit look?
So when you come to an ear, nose, and throat doctor, one, we're really nice. And so we make it very easy to talk about what's going on with the voice. We'll ask you not only about what's going on with your voice, and those details will be, you know, what's happening with it. Is the voice lower in pitch? Is the voice higher in pitch? And it actually reverses a little bit. So for some men who are used to a really low voice, their pitch will get higher. For some women who are more higher pitched, their pitch will get lower with aging. We'll also ask you about other medical issues. You know, do you have allergies? Do you have problems with your lungs? The lungs are the power behind the voice. So if we're not keeping our bodies healthy, our lungs healthy, it can have some impact as we get older on the voice.
Wow, that
Then we'll
makes a
take
lot. Yeah, go ahead. I'm sorry.
then we'll take a really good look at your ears, your nose, your throat. And sometimes, and in many situations, we'll take a really small camera that we use with a small scope to go in your nose while you're awake, while you're sitting in a chair, and look down at the vocal cords so that then we can review those pictures after we're done together and see what's going on with the vocal cords.
Wow, that makes sense. So are there some treatment options if you notice that there's some problems?
Absolutely. And so we try to look at this holistically. So we want to make sure that one, there's nothing concerning on the vocal cords. Sometimes we can see some nodules from people that overuse their voice. They're very treatable. Sometimes we can see some weakness of the vocal cords that may have happened through time for a variety of reasons, from surgeries or infections or other things. And we have procedures that can actually plump up those vocal cords to make them act like they used to before the muscle weakness.
Oh, wow.
Sometimes we use things like speech therapy. Speech therapy is really effective for helping to reset and rebalance those vocal cords and get them back into good shape.
Wow. Now, after all of that, the bottom line is you have to keep your voice healthy. And I even know that in my own profession. So what are some tips that you would say would help us all keep a very healthy voice?
Yeah, you're a high volume vocal user, so you have really high demand in your job. And so many of us actually do, and we don't even realize it. So we think about people like teachers, we think about pastors, we think about people that are on the phone a lot, especially right now with COVID. We're all on these Zoom meetings and on the phone talking to friends because we can't see them. And when we're on those meetings, we have to push our voice. We have to project our voice on the phone. And so you can see I'm wearing this special microphone because it lessens the effort that I have to use when I'm on these Zoom meetings. So we really want to watch how much we're using it, how loud we're being, and really trying to make sure that we're not constantly being loud and constantly pushing the voice. Since they're muscles, it's kind of like trying to run a marathon. We can't run a marathon every single day. We can't be loud and use our voice continuously every single day. It won't work. So that's important. We want to hydrate really well. So that old, adage of 6 to 8 cups of water is important. It moisturizes the throat. It keeps us from having dryness, which can be very irritating to people that use their voice a lot.
Wow. So don't talk too much. Don't talk too loud all the time, especially on times when you don't have to.
Yeah.
Keep your throat from being dry. You said 6 to 8 cups of water is very good. Is there any other tips before we go that you feel would be good as far as vocal health?
Now, I think with what I don't want people to do is not use it. The voice is that really important piece of making social connections. And it's the biggest piece of aging. Use it, but just be conservative with it. So use it a little, rest it a little. Try to avoid pushing it too hard, particularly day after day. Try to avoid throat clearing and too much coughing because that really hurts those vocal cords, and enjoy it. And if it's not working well, we should take a look and see what might be going on.
Get it checked out. I like that. I like that. Well, I really appreciate Dr. Nicole for helping us out and helping us really figure out how to have a better voice and understand the natural progression as we age. And so that's something that you guys who are watching should always look at. And I want to thank you also for expanding our knowledge on this, and also for university hospitals making sure that we have this kind of information because it's very important. Before we go, if there's just anything you want to share with our viewers, please go ahead.
I appreciate this opportunity. For me, I'm very passionate about the impact of the voice on our social networks and on the people that we're around. So I would just encourage you to use your voice, enjoy your voice, realize that maintaining your overall health is part of maintaining your voice. These are muscles. They are really critical for us, and all the things that you normally do, you should enjoy and you should do. And if things are not right, particularly after 2 or 3 weeks of the voice being off, you should absolutely have it evaluated.
Makes sense. Make sure that you continue to realize that good health is good wealth. And so thank you so much, Dr. Maronian, for all that you're doing at university hospitals. And thank you for giving us all this great information.
I enjoyed it. Thank you so much.
And I also want to thank all of our viewers. Remember, you can go to my website at larrymaconjr.com, where I have other interviews where you can check out other elements and other things that may be helpful to your health. And also, you can follow me on Facebook and Instagram as I post daily inspiration to help you throughout your week. And so again, we're thankful that we're able to get more knowledge from university hospitals. Thanks again, Dr. Maronian.
Thank you.